Have you been told that the cause of your persistent back pain is a bulging disc? Well, it might not be. In this video, I'm going to explain more. Let's check it out. Hey there, it's Simon here from Hogan and Mitchell, and in this video, we're going to be talking about if a bulging disc really is the cause of your persistent pain. So first of all, we need to talk about discs. Now, discs are the things in between your bones, in your spine, and they act as shock absorbers. They are very, very, very tough indeed. But sometimes you will have a bulge within them. Now, well, I'm going to be a bit geeky for a moment, and we're going to talk about some science. Stay with me, it's dead easy to follow, and it should explain a lot of what I'm talking about. So there's a thing called a systematic review. Now that's a type of research paper where basically they get lots of different research papers and they chuck them all into one study and they try and come out with an outcome, a result, and something that's useful for all of us to use. So they took a systematic review of MRI scans, and these were MRI scans in people who had no lower back pain and no sciatica. And they took people in their 20s, 30s, 40s, 50s, 60s, 70s and 80s. And they did an MRI scans on these people. And they talked about, at the end of the study, what is the percentage of people who have various things on their MRI scans. Now, how many people were involved in all of these studies in total? There were over 3,000 people that they scanned who had no lower back pain. Now, I'm going to keep saying that, no lower back pain, because that's really important. And what they found is that in 30% of people in their 20s, so this is people aged 20, 21, 22, all that 29 into just about 30, they found that 30% of those people had a disc bulge, yet they had no pain. Interesting, right? Now, the next thing they did is look at people in their 30s. And what did they find? They found that 40% of people within their 30s had a disc bulge. But in this group of people, none of them had any lower back pain or sciatica. They looked at people in their 40s, and they found that by your 40s, 50% of people had a sign of a disc bulge on their lumbar spine MRI scan. And guess what? As you get older, it increased. So by the time they looked at people in their 70s to 80s, there were about 80% of those people who had signs of a disc bulge. Now, what does all this mean? Well, what it means is that if you scan people with back pain and you scan people without back pain, so basically if you just scan people, you're going to find signs of a disc bulge. But that does not necessarily mean that that is the cause of your persistent back pain. So the key bit is if the disc bulge is large enough and has a combination of other factors around the space for the nerve as it leaves your spine to contact that. And that will then give you sciatica. So a disc bulge in itself rarely causes any problem unless it's more going into a space, and that would tend to get called a herniation or a prolapse or what people call it a slip disc. But a disc bulge is a very normal thing to find in a healthy spine of someone who has pain or who does not have pain. So there you go, disc bulges in a nutshell. So maybe if you are one of the people who have been diagnosed when you've been told that your back pain is due to a disc bulge, maybe you might start thinking a bit differently. And maybe there are some other reasons why you may have your back pain. I hope you found this video interesting. If you have, you can like or comment below, you can ask us a question and we'll promise to get back to you. And do a favour for me, just click over here and click subscribe. Thanks for watching, I'll see you soon.